Thank you for tuning into NorthPoint, Making Health Happen. My name is Biftu and I'm your host. This is a new series brought to you by NorthPoint Health and Wellness Center. We want to connect with you about topics in health and wellness that impact our community. We will feature guests from our team and around the community to talk about the health and wellness issues most important to North Minneapolis. Together with our guests, our community, and you, our listeners, we are partnering to create a healthier community. Today we are joined by Dr. Robin Councilman, a family physician at NorthPoint Wellness Center for the past 20 years. She graduated from the Washington University Medical School in St. Louis and did her family medicine residency at Hennepin County Medical Center. Dr. Councilman's special interests include immigrant and refugee health, primary care obstetrics, and hepatitis B. So, welcome, Dr. Robin Councilman. Thank you for joining us. Today we're talking about World Hepatitis Day, and you're here to answer some of our questions. So thank you.
Thanks for inviting me.
Absolutely. All right, so let's get started. Let's talk about hepatitis. Maybe you can give us an overview of what that disease is.
So hepatitis is actually hepa, which means liver, and itis, which means inflammation. So hepatitis is anything that causes inflammation in the liver. Doesn't have to be infection, though I think what we're talking about today, because it's what's most common right now, is infectious hepatitis. And I tell my patients to think of inflammation, when I talk about inflammation, to think of a skin knee. That swelling, that redness, that throbbing, that sometimes oozing, that is a good example we've all seen of inflammation.
Okay, thank you. And then you talked about the liver too. So tell us about what the liver does.
So your liver cleans your blood. It also helps with your digestion, and people know that more because that's in the form of gallbladder. And gallbladders have a tendency to act up on us and make us sick occasionally. But the main function of the liver actually is that our blood goes through it and it helps to take out a lot of the bad things in our blood.
So tell us about the different versions of hepatitis. So there's A, B, C. Can you tell us a little bit about those differences and maybe how you would contract them?
Okay, so hepatitis A, it's good. Hepatitis A and hepatitis C are very different, and hepatitis B kind of falls in the middle. Hepatitis A is an infection that you get, we call it fecal oral, meaning that you get the virus comes out in somebody's stool, they get it on their hands or some type of surface, you somehow get it into your mouth and you get sick from it. And hepatitis A either causes no symptoms occasionally, which is how it passes on to other people, or it can also cause you to get very sick very fast. You get the viral symptoms, the fever, the body aches, the feeling like you have the flu, but then you get stomach pains in kind of up under your ribs on the right. You can turn yellow. You can get bleeding from your gums. You can get really sick, but most people then get better. And once you've had hepatitis A, you can't get it again. You're immune to it. You can get exposed to it all you want. You'll never get it again. You get it, you get sick, and most people get better. And then you're protected. Hepatitis C and B, actually, you get through body fluids. So blood, semen, possibly saliva. You get it through fluids from inside the body. Hepatitis C, you get, and you don't know you got it. It doesn't, maybe it causes, that feeling like, I think I'm getting a cold, but I don't know. I'll wait and see in the morning if I have anything. That kind of little bit of body aches, little bit of feeling under the weather. But generally, you don't feel like you're sick. And you can have hepatitis C for 30, 40 years before you get sick from it. And that's what's scary is by the time you get sick from it, you are really, really sick. And the body is not good at getting rid of hepatitis C. So hepatitis B falls in the middle. It, like hepatitis C, you get from body fluids. And a common way, actually, we know hepatitis B is passed, and we're figuring out that's probably some of hepatitis C also is moms to babies. A person is pregnant, they don't know that they're sick, they have a baby, and that baby can get it. Hepatitis B can make you sick like hepatitis A, especially if you get it when you're an adult. So, you or I get it tomorrow, we are probably either going to have no symptoms and clear it, or we're going to feel like we had hepatitis A. We're going to throw up, we're going to get body aches, we're going to get fever, but we'll probably get over it, be cured of it, be immune to it. If kids get hepatitis B, though, they tend not to have any symptoms, and they tend not to get rid of it. And so they will have it the rest of their life. And like hepatitis C, over time, they get damage going on to their liver that they don't know until often it's too late.
Can you tell us about how common it is between hepatitis A, B, and C, those different strains?
So hepatitis A, we've had a vaccine for it since, I date things by my children, since for about 25 years now, we've had a vaccine for it. And so all children who are born in this country or go to school in this country, unless they opt out, are vaccinated. And so the rates have really gone down. The last data I could find was 2019, so before the pandemic. And that was actually the highest year because there was 2 big outbreaks. And it was 5 cases in 100,000 people. So what happens is the big outbreaks are restaurants, and it can be very nice restaurants. When I was in medical school, we had a huge Hep A outbreak. We had so many really sick patients in the hospital, and it was related to a restaurant we all ate at. It was a great restaurant. Someone had very little symptoms or no symptoms, came to work, and it spread. You can also, any of these you can get through using drugs, and that was part of the outbreak in 2019. But 5 per 100,000 means about 1 in 20,000 people got it that year. Hepatitis B and C are harder to say how many people get it because, as I said, some people have it for a very long time and don't know it. Mm-hmm. So for hepatitis B, I mentioned there's the 2 types. There's a type that looks like hepatitis C and the type that looks like hepatitis A. So the acute type, the type that looks like hepatitis A, that you get sick and then you get better type, has become very rare because that's also got vaccines. And so babies start their vaccinations actually before they go home from the hospital after being born. And so in 2019, it was 1 per 100,000 people. So we're doing a great job with preventing acute hepatitis B. The problem that gets in is the chronic type, the type that the baby gets it when being born or very early in life. And it's estimated that 2.5 million people in the United States have that type, the chronic hepatitis B. And what's scary is that only about 1 in 4 of those people actually know it. So by not knowing you have hepatitis B, you can't know if you should get treated. You can't watch for problems from the hepatitis B, and you can spread it. If you get pregnant, you can spread it to your baby, but you can also spread it to your partner, you can spread it. And so that is a problem. Hepatitis C, we mentioned, is always that chronic type. So it's the same problem. People tend to have it for a very long time and not get sick. Now, there's been a recommendation that everybody in the United States get tested for hepatitis C. And it started with older people, the baby boomer group. We've been testing probably for about the last 10 years. So it's thought that we've about a quarter to half of people who have hepatitis C actually know it. And they're talking 2.5 million to not quite 5 million people in the United States with hepatitis C. Hepatitis C is the most common type of hepatitis in the United States.
When we look at different groups that are affected at higher rates, you kind of touched on this a little bit, but can you tell us about racial or ethnic minorities that might see higher rates of hepatitis in their populations?
Okay, so big one is, so in hepatitis B, you look at the US population. Asians are 6% of the US population, but 58% of the people living with hepatitis B. So that is the big group. That said, that immigrants from Africa account for 12%, and their total number in the population is much lower. Non-Hispanic Blacks have 6% higher rates of hepatitis B, and hepatitis C. It's hard because we don't know these numbers real well. Hepatitis C, it also seems higher in people of color. And unfortunately, like too much in medicine, the rates of treatment show a huge disparity. If you're white, US born, non-Hispanic, you're much more likely, if you have these diseases, to have been treated or be on treatment than other groups.
And I think, you've described this a little bit more, but tell us maybe in more detail about symptoms of hepatitis.
Okay, so all of them at some point when you get really sick, whether it's right away with A or right away with B, or in 40 years with B and C, because your liver's then not working. So you get sick because you're not making proteins, which is why you swell up in your stomach. The proteins keep your fluid in your blood, and so when there's not enough, the fluid goes elsewhere. So it can be in your legs, it can be in your stomach. For other reasons, because of where the liver is in your stomach, you actually tend to get a lot of the fluid in your stomach, or your abdomen. One of the things that backs up is called bilirubin, and that makes your eyes turn yellow, your skin turn yellow, your pee turns a weird color like brownish. And actually your stool, your poop, turns like whitish or light yellowish, because that bilirubin has to get out somewhere else. You get nauseated, you throw up, you don't want to eat. And as I said, you can get cancer from it. In that case, your liver can start getting big or getting sore. People tell me, my patients tell me, I can't have it because I don't have, my liver doesn't hurt. My liver is not big. And you don't want to get to the point that your liver hurts or your liver gets big, because at that point, so much damage has been done. Your liver is amazing. You don't need your liver working 100%. Some people donate parts of their liver and our body manages. That's why it sneaks up, the B and C sneaks up on us, because we can destroy a large part of our liver before we get really sick. But once we pass that point that the liver, you no longer have enough liver to do the things you need, then you're in a lot of trouble.
Right. Okay, so let's talk about prevention. What do you recommend to prevent spreading of hepatitis?
Okay, so the single most important thing in prevention actually is to know if you, one is to know if you carry it. So
Mhm.
get tested so you don't spread it to somebody else. Number two is immunizations. Because as I said, hepatitis B and hepatitis C immunizations both are 20 to 25, 25 to 30 years old that we've been doing it. So that does mean there's a significant part of the population that's older than that who may not have received those shots. And so it's worth talking to your healthcare provider, getting tested to make sure you don't have it or already protected, and then go ahead and get the shots. We unfortunately don't have shots to hepatitis C at this time. And then what we can do to prevent it is the same, you don't want, if you're using drugs, you don't want to share needles. And NorthPoint has a program that can help with that. Talk to us if you need help with that. And if you're having sex, you want to use condoms. Other forms of birth control do not protect against hepatitis. Condoms are the only way to protect yourself when you're having sex. And then if you carry hepatitis B or hepatitis C, we'll talk about treatment, because certainly if you get cured of it, you're less likely, or keep a low level of it, you're less likely to spread it to somebody else.
Yeah, let's talk about that. Let's talk about treatment. So I think you mentioned hepatitis A. If you're treated for that, you're good. But I'll let you talk about the different treatments.
Okay. So hepatitis A, there's been a few good things about the pandemic, and people have learned a whole lot about viruses.
Right.
So hepatitis A, all of them being a virus, there's few treatments, particularly for hepatitis A. That said, the key with hepatitis A is getting people over the really sick part. And so if they're really, really sick, things like fluids, because they get terribly dehydrated. Sometimes they need us to give back some of those proteins in their blood. Sometimes they need us to try and help clean their blood. It's things like that to give people's bodies the chance to heal. For hepatitis B and hepatitis C, there are some treatments. And hepatitis C is great news in medicine. We can cure hepatitis C now. And 10 years ago, we could cure hepatitis C in some people they had to take some really nasty medicines for a year, but we could do it in some people. Now we have very good medicines that are much easier to take with much less side effects, and you take them for a few months, and they can cure almost everybody. Nothing in medicine's 100%, but this is very close. And so we can cure people from hepatitis C. So that is great. And that's great news for people with hepatitis C. And I would say if somebody knows they have hepatitis C, but was told in the past that they didn't qualify for treatment, it's time to go back and talk to your healthcare provider, because the old medicines had a lot of people who couldn't take it because of their side effects. And these new medicines we can treat most everybody. Hepatitis B is a little frustrating in that we can manage it, but we can't cure it. Kind of think about it more along the lines. People are more familiar with the treatment for HIV or AIDS. There's medicines we can give that makes it settle down to a very low level, not cause a lot of problems, but not yet do we have the ability to make it go away. And that's where we are with hepatitis B. Some people's bodies keep it at a low level, and all we need to do is make sure it stays at that low level. And other people's, their bodies can't control it and they need medicine every day to keep it at a low level, because the lower the level of it, the less liver damage and less problems from it. I keep hoping for that the day is coming that we can cure hepatitis B, but right now, hepatitis C we can cure, and that's a great reason to know you have it.
And then finally, let's talk about what we do here at NorthPoint and what services are offered to around hepatitis.
Okay, so testing is step one, and we test for all 3 types. So hepatitis A, we can either immunize you or test and see if you need immunization or if you have it. If you're getting sick and think you might have hepatitis A, come see us. We can see if you've got it. We can test for hepatitis B and hepatitis C. We can immunize patients for hepatitis A and B. Certainly it's way better to never get a disease. Mm-hmm. And the best way not to do that is to get protected for it. So if you haven't had the immunization or you're not sure, come see us. We can give you the hepatitis A and hepatitis B shots. And then we can find out if you have it. So if we can test you Hep B and Hep C. If you have it for Hep B, we can figure out what risk you're in. Do you have much virus? Do you not have much virus? Do you need treatment? If you need treatment or might need treatment, we refer you to the specialists, and we have specialists we work with. If you have hepatitis C, this is new. We are just starting in conjunction with some liver specialists through the cities to start treating people who don't have evidence of ongoing liver disease at this time for hepatitis C. If we see you, test you for hepatitis C, decide you have it, but are worried that you have some liver disease going on, so you need some more careful follow-up with treatment, we'll refer you to one of our liver specialists that we work with. But we can, as of this month, start treating you for hepatitis C.
Okay, wonderful. And I'll put that information on the screen so folks know where to go.
Yes. And if you know you have hepatitis C and want to come talk to us for treatment, it's really helpful if you tell them when you schedule, because not all providers are going to do that. So if you say, I want to talk about treatment for hepatitis, they'll schedule you with one of us who can do that for you.
Wonderful. Great. Well, thank you, Dr. Councilman, for answering our questions. Is there anything else you'd like to say about the
topic? I do. My one thing that I tell everybody is people think that they can't have hepatitis. And I think for all of them, we've done a bit of a disservice. For hepatitis A, people think, well, I eat at legitimate restaurants, or, I'm clean around my house when I cook. I don't eat food that smells bad, that kind of stuff. And so I can't have hepatitis A. Well, you can have hepatitis A outbreaks at the nicest restaurants, most expensive restaurants around. So anybody can get that. The same with B and C. Yes, you can get B and C by having sex and by using drugs, but that's not the only way. And so I see a lot of people who say, well, why should I get tested for hepatitis B or hepatitis C? I've only had one sexual partner. I've only had, a couple sexual partners. I've never used drugs. And so I can't have hepatitis B or hepatitis C. And that's not true, especially with the transmission from a pregnant person to a baby. Anybody can have hepatitis B and hepatitis C, and the only way to know that is to get tested. So I would encourage everybody should, next time they see their healthcare provider, ask, hey, have I been tested for hepatitis C, and what was the result? And certainly if you're an immigrant, so you were born anywhere other than the United States, Canada, or Western Europe, or I think Australia, or you were born to somebody who was born in Asia or Africa, then you should ask, hey, have I been tested for hepatitis B, and what were those results? And if I haven't been tested, then please test me so I know.
Okay, great. Thank you. All right, Dr. Robin Councilman, thank you so much for your time and answering our questions for World Hepatitis Day. I think we've all learned a lot, so thank you for informing us. Thank you for listening to NorthPoint, Making Health Happen. We want you to know that we are here to partner with you, that you can dream, and that you can reach your dream. Please subscribe to our YouTube channel to watch our show in video format. And if you like what you hear, share with a friend. To read more about NorthPoint or find out more about the COVID-19 vaccine, check us out on the web at northpointhealth.org.
When you walk through the doors, we're here with open arms. We know that times get hard.